Good morning. Good Sunday morning, everyone. It's beautiful here in Florida. 73 degrees it was this morning early and nice breeze. It's been real good, real nice weather lately. A lot of wind, but I guess you have to put up with something, right? So I hope everybody's having a beautiful day. I'll just offer a small prayer of my own. Dear Father in heaven, I thank you for this day, and I pray that you will open the ears and the minds of the people that are hearing me. I pray that you'll let them understand what it is I'm telling them and help them to see how things all work the way they are working. I pray that you'll watch over us all and that we'll do your will each day. And I thank you in Jesus' name. Amen. I'm going to read you Psalms 119, the next part. Starting at 121. I have done judgment and justice. Leave me not to mine oppressors. Be surety for thy servant for good. Let not the proud oppress me. Mine eyes fall for thy salvation and for the word of thy righteousness. Deal with thy servant according unto thy mercy, and teach me thy statutes. I am thy servant. Give me understanding, that I may know thy testimonies. It is time for thee, Lord, to work, for they have made void thy law. Therefore I love thy commandments above gold, yea, above fine gold. Therefore I esteem all thy precepts concerning all things to be right, and I hate every false way. So I hope, thanking everyone who's here this morning listening. For those of you in chat who may not know who I am, I'm Honest Grandma. I give updates on food, wellness, vaccines, and cleaning options without unsafe chemicals. And we are on number 4 of Immunity and the History of Vaccination. The information discussed here is not intended to in any way diagnose, treat, or prescribe, but is for information only. Please learn what works for you. Food can be a positive or negative in your own life. I am not a doctor, but taking excerpts from the books Dissolving Illusions and the Virus and the Vaccine. Okay, and this may seem a little tedious to you, but look at it from this standpoint. There's a lot of information on polio, and people don't realize the progression. I'm looking at it and seeing all of the parallels between that, what was done with polio back in the day, and between then and now, and what we've seen with this coronavirus, and how the establishment, for lack of a better word, that sort of covers them all, how the establishment has handled it. And I can see, why the people who were smarter than me back in 2014 were starting to say then, look out, because what they're doing now, they're going to be doing more of later. And you going around vaccinating your kids, putting these shots into your kids without understanding what they're doing to them. And you're next. And people will line up. And didn't they? So it's just I see so many parallels in here to things that have gone on over the years with other vaccines. So anyway, so this is polio. I won't get lost in the weeds. There is a lot, I'm warning you, there is a lot of information here, but I believe in order to get the correct picture of everything, you need to have at least a little bit of all of this, because it doesn't all come together. The polio is a long and disgusting process that we've been through in our lives and the lives of our grandparents even back then. So I will get started here on this. So this week is going to be all polio and having to do with polio. And next week, I'm not sure yet how things are going to go. Depends on how far I get today. But please bear with me. There's a method to the madness, and there is a lot of information. And I'm using Dissolving Illusions by Suzanne Humphreys, and The Virus and the Vaccine, the true story of a cancer-causing monkey virus, contaminated polio vaccine, and the millions of Americans exposed. And they're both big books. And there's a lot of information. So here we go. We're now going to start this on natural or wild poliovirus. A natural virus or any illness or whatever that they may be vaccinating for, they will always call it the wild virus is the natural virus. And they have to do that to distinguish between that and the ones that were manufactured. Because most of them are. Okay, so polio has afflicted mankind for millennia. An ancient Egyptian funerary carving from the 18th dynasty portrays a priest with a withered limb. Polio has afflicted mankind for millennia. An ancient Egyptian funerary carving portrays the priest with the withered limb. I'm reading from the book now. Sorry, I didn't realize. Hippocrates referred to paralytic attacks that occurred mainly in the summer and autumn. The Bible refers to individuals with paralyzed and atrophied limbs. A Bruegel painting from the 16th century includes a crippled beggar, and in 1921, an archaeological dig in southern Greenland found 25 skeletons from the 15th century with bone deformations characteristic of polio. Despite the ancient record of the disease, epidemic polio was unheard of until the Industrial Revolution. The vast majority of polio victims suffered little permanent damage until the 20th century. So, naturally existing poliovirus was a common bowel inhabitant for millennia, always there, continuously circulating through humans, but never causing paralysis until later on when something changed. The key question is, what opportunities could have arisen that afforded poliovirus the ability to cause epidemics in the early 20th centuries? Under healthy environmental and dietary conditions, populations had antibodies to all three types of the virus and did not develop paralysis or have significant symptoms did not have significant symptoms after infection. Isolated native tribes seem to have had no problem with the infections that were plaguing white men, even though blood results showed that the natives were indeed exposed and infected by many of the same germs. These isolated people who had not adopted any of the habits or medical interventions that are now known to increase susceptibility to poliovirus were fully infected and immune. Native Indian populations had evidence of infection with all three strains of poliomyelitis, but developed no poliomyelitis whatsoever. And I've got a quote here. Studies of antibody avidity according to the techniques of Sabin in 1957 were made on randomly selected specimens. All specimens were positive for antibodies to all three types of poliomyelitis, providing additional confirmation of the validity of the findings. And this is in parentheses, that the Indians were all immune and none of them were paralyzed. And that's end of the parentheses. The percentage of positive reactors is striking. These people had true herd immunity. Dr. Sabin was puzzled about the clean and advanced parts of the world getting sick, in quotes, but failed to connect the rate of paralysis to easily identifiable factors. Examining what changed in environment and human diet and how that affected susceptibility to paralysis in developed areas is key to understanding polio. The white man's diet of refined processed foods, lack of vitamins, Environmental and agricultural poisons and specific invasive medical procedures contributed to the rise in susceptibility in industrialized parts of the world. By the time connections were made, disease-causing foods were already ingrained in the modern palate, and medical advances were met with gratitude, though many were dangerous and overused. Refined sugar, white flour, alcohol, tobacco, tonsillectomies, vaccines, antibiotics, DDT, and arsenic became financial golden calves that led humanity blindly down a spiral of disease and misery. Unfortunately, paralysis was uniformly attributed to poliovirus infections, which justified and prioritized vaccine research at all costs. Okay. Many thousands of people were needlessly paralyzed because the medical system refused to look at the consequences of the golden calves. They gave only lip service to the success of the Sister Kenny treatment of paralysis, discussed later in this chapter, and concentrated solely on vaccine research. What poliovirus was and where it is now. Before vaccine was in widespread use, many distinct diseases were grouped under the umbrella of polio. It was only after vaccine was widely accepted that there was an effort to distinguish poliovirus from other types of paralytic disease. Here is a list of the few that could have been categorized and documented as polio prior to 1958. Enteroviruses, such as Coxsackie and Echo. Undiagnosed congenital syphilis. Arsenic and DDT toxicity. Transverse myelitis. Guillain-Barré syndrome. Provocation of limb paralysis by intramuscular injections of many types, including a variety of vaccines. Hand, foot, and mouth disease, and lead poisoning. These are all conditions that still exist today and that a polio vaccine could not prevent. The face of polio may have changed, but it was mostly due to the power of the pen, advances in diagnostic and life support technology, removal of certain toxic influences, and advancements in physical therapy. Specific polio diagnosis was not pursued with laboratory testing before 1958. The diagnostic criteria for polio were very loose prior to the field trials for the vaccine in 1954. Before the vaccine was deployed, healthcare professionals were vigilantly programmed to be on the lookout for polio. After the trials, they were vigilantly noting who developed the polio, vaccinated or unvaccinated, and made every effort to diagnose a non-polio illness in a vaccinated person. Dr. Bernard Greenberg, head of the Department of Biostatistics of the University of North Carolina School of Public Health and chairman of Committee on Evaluation and Standards of the American Public Health Association, stated in 1960, and excuse me one second while I drop you the next. Okay. So this is where, this doctor hit this quote from this doctor in 1960. Prior to 1954, any physician who reported paralytic poliomyelitis was doing his patient a service by way of subsidizing the cost of hospitalization and was being community-minded in reporting a communicable disease. The criterion of diagnosis at that time, both health departments followed the World Health Organization definition: spinal paralytic poliomyelitis, signs and symptoms of non-paralytic poliomyelitis, with the addition of partial or complete paralysis or one or more muscle groups detected on 2 examinations at least 2 hours apart. Note that 2 examinations at least 24 hours apart was all that was required. Laboratory confirmation and presence of residual longer than 24 hours was not required. The practice among doctors before 1954 was to diagnose all patients who experienced even short-term paralysis of 24 hours with polio. When Salk vaccine was released in 1955, the diagnostic criteria became more stringent. If there was no residual paralysis 60 days after onset, the disease was not considered to be paralytic polio. This change made a huge difference in the documented prevalence of paralytic polio because most people who experience paralysis recover prior to 60 days. Dr. Greenberg said the change in 1955 meant that we were reporting a new disease, namely paralytic poliomyelitis with a longer lasting paralysis. Furthermore, diagnostic procedures have continued to be refined. Coxsackie virus and aseptic meningitis have been distinguished from paralytic poliomyelitis. Prior to 1954, large numbers of these cases were mislabeled as paralytic poliomyelitis. Thus, simply by changes in diagnostic criteria, the number of paralytic cases was predetermined to decrease in 1955 to 1957, whether or not any vaccine was used. Showing how much paralytic disease thought to be polio was not at all associated with polioviruses was the Michigan epidemic of 1958. This occurred 4 years into the Salk vaccine campaign. In an in-depth analysis, it was revealed that more than half of them were not poliovirus associated at all. There were several other causes of, quote, polio besides poliovirus. During an epidemic of poliomyelitis in Michigan in 1958, virological and serological studies were carried out with specimens from 1,060 patients. Fecal specimens from 869 patients yielded no virus in 401 cases, poliovirus in 292, ECHO or enteric cytopathogenic human orphan virus in 100, Coxsackie virus in 73, and unidentified virus in 3 cases. Serums from 191 patients from whom no fecal specimens were obtainable showed no antibody changes in 123 cases, but did show changes diagnostic for poliovirus in 48, echoviruses in 14, and Coxsackie virus in 6. So a large number of paralytic as well as non-paralytic patients, poliovirus was not the cause. Frequency studies showed that there were no obvious clinical differences among infections with Coxsackie, echo, and poliomyelitis viruses. Coxsackie and echo viruses were responsible for more cases of non-paralytic poliomyelitis and aseptic meningitis than was the poliovirus itself. And that's an end of the quote. After the vaccine, there was a concerted effort to distinguish cases with poliovirus from cases without. This was not a concern prior to 1958, when many diseases common today hid behind the name poliomyelitis. Transverse myelitis, viral or aseptic meningitis, Guillain-Barré syndrome, or GBS, chronic fatigue syndrome, spinal meningitis, post-polio syndrome, acute flaccid paralysis, or AFP, enteroviral encephalopathy, traumatic neuritis, Reye's syndrome, etc., could all have been diagnosed as polio prior to 1958. A modern scientific publication has even cast strong doubt on President Franklin Roosevelt's well-publicized polio diagnosis. The conclusion of a team of modern researchers is that he actually had GBS and not polio, as was originally believed. Next part. If polio is still here, why don't we see it? Wild poliovirus was never the big killer or paralyzer the public was led to believe it was through the many frightening images shown repeatedly in the 1950s. Dr. Lynette, a well-respected virologist and pioneer of diagnostic virology at the California Department of Health, said in September of 1987, actually, economically, the disease wasn't very important. Secondly, not many cases were seen in this country. There weren't too many people paralyzed from polio in any one neighborhood, so it never made much of an impact, end quote. The images of polio that were used to rally the public towards vaccine development and acceptance dropped away after the vaccine campaign began. The public gratefully embraced the vaccine that was believed to have removed the frightful disease. To maintain public belief in the vaccine, especially in light of several serious instances of vaccine-induced paralytic polio, images of polio in the new, highly vaccinated population had to be deleted. Optimism regarding the vaccine prevailed. What does that sound like? My comment here. The pictographic and cinematic images of polio that were used to rally the public towards vaccine development, excuse me, I already read that, sorry. Optimism regarding the vaccine prevailed. Okay, next. The March of Dimes campaigns that were once designed to impact human fear and emotion transitioned into what we see today as advertising for, quote, working together for stronger, healthier babies, end quote, funding vaccines for infants and pregnant mothers. And I'm sure looking at this through today's lens, you can see what it really is, or really was. Sorry about that. I have to find my little marks. Okay, in the 1940s, physical therapy and mobilization were recognized and developed as an important early intervention for paralysis victims. Cruel and barbaric treatments listed in, quote, A History of Poliomyelitis by Dr. J.R. Paul. I'm sorry. Yeah, I guess he was a doctor. Dr. J.R. Paul, which included tendon cutting and transplantation and other, quote, salvage operations, early and prolonged splinting, surgical straightening, and painful but effective electrical treatments were abandoned. So images of crying children in plaster casts and splints were not as prevalent. Outcomes in paralysis and deformities improved simply because the disease began to be treated better. But change did not happen overnight. Sister Elizabeth Kenny, a pioneer of what is now known as physical therapy, spent 30 years to get the orthodox medical community to accept that they had been incorrectly treating polio and responsible for much of the residual paralysis, deformities, and lingering stiffness in polio victims. Dr. John Pohl, strong supporter of Sister Kenny, reflected misery endured by polio victims before the Kenny technique was used in 1940, Minnesota. This is a very important link to the story of polio. As a result, the images of the children. Sorry. Hold on a second. I think I lost my place. Okay. Okay, we got that already. Okay, Dr. John Pulsis, one of Sister Kenny's strongest American supporters, reflected on the misery that polio victims endured before the Kenny technique was used in Minnesota, circa 1940. The more she talked, the more it seemed she made sense. Before she came, our city hospital was just crowded with polio, and treatment, in plain language, was just no damned good. If you could have visited the hospital, you would have seen little kids lying stiff and rigid, crying with pain, even though, as she saw, they were not necessarily paralyzed. We'd take the children to the operating room in those days, straighten them out under anesthetic, and put them in plaster casts. When they woke up, they screamed. The next day, they still cried from the pain. That was the accepted and universal treatment virtually all over the world. I saw it in Boston and New York City and London. She said, that's all wrong. The improper treatment of poliomyelitis led to the dysfunction of limbs, regardless of whether the virus was present or not. Dr. Donald Solant and his associates at University of Toronto reported that completely immobilizing an animal's limb produced similar muscle changes as nerve cutting or removal. His research demonstrated that mobilization alone was enough to induce flaccidity and apparent paralysis, even with a completely intact motor and sensory nerve pathways. This is a very important link to the story of polio, and the manner in which stiff, painful, numb muscles were handled by doctors had a lot to do with the early phase of polio and why it looks so different today in countries where paralytic poliomyelitis is treated differently. The improper treatment of poliomyelitis led to dysfunction of limbs. Okay, I read that. Okay, the next part. Later writing by Mead also described how polio victims were treated in hospitals. Orthopedists believed in the extreme fragility of poliomyelitis muscle. Many victims of this disease were cast in plaster for 6 months or so, and their deformities were operated on in due course. Not even massage, much less vigorous exercise of the affected muscle, was countenanced. And that's why it still looks so different today in countries where paralytic poliomyelitis is treated differently. The expectation among doctors and the public was that poliomyelitis meant a life of corrective surgery and lameness, but Sister Kenny proved them wrong. So next, these are some of the different various things that go on that they were confusing with polio. Things that weren't actually polio. This is important because so many things in our recent past have been done this way, and just from pure ignorance. So, and I'm reading. If you don't see what I'm reading, don't worry about it, because I'm reading some selections because there's just too much to put in the reading part that for you. I'm putting the basics in there, and then I'm reading where I need to add things in, so it's okay. Okay, first is the iron lung and transverse myelitis. This is why I've put in these red headings here, so you know where I'm at. We no longer have iron lungs that look like miniature space rockets, the continuous images of which could instill morbid fear in any parent. We now have small boxes with tubes going directly into the airway called a ventilator. Dr. Douglas Kerr of Johns Hopkins stated in his foreword to the autoimmune epidemic 2009, infants as young as 5 months old can get transverse myelitis, and some are left permanently paralyzed and dependent on a ventilator to breathe. My colleagues at Johns Hopkins Hospital and I hear about or treat hundreds of new cases every year. Does the public have any idea that there are hundreds of cases of something now called transverse myelitis that would have historically been called polio and is now leaving children permanently dependent on the modern version of the iron lung? Approximately 33,000 people are afflicted by transverse myelitis in the U.S., with 1,400 new cases per year. The symptoms of this disease are described by the NIH. This is but one disease that would have been called polio in the years leading up to 1954. So what causes transverse myelitis? Researchers are uncertain of exact causes of transverse myelitis. The inflammation that causes such extensive damage to nerve fibers of the spinal cord may result from viral infections or abnormal immune reactions. It may also occur as a complication of syphilis, measles, Lyme disease, and vaccinations. Cases in which a cause can't be identified are called idiopathic. Okay, the next one is DDT poisoning, a cause of polio-like illness. Flies were believed to spread polio outdoors and in homes. Fearful parents sprayed DDT on windowsills, sprinkled it in sandwiches in their kids' lunchboxes. DDT in water was used to rinse clothes, bedding, and mattresses. It was thought to be a safe and effective insecticide. Have you heard those words before? Safe and effective? They seem to use them a lot, don't they? That's my comment. Safe enough to spray at public beaches and on children to halt the spread of polio. In the 1960s, convincing evidence was found that pesticides led to increased susceptibility of viral invasion. DDT was found to enhance the disease and intracellular multiplication of poliovirus. This information was not published in the medical literature and until a full decade after polio vaccine was an accepted solution to the poliovirus. DDT was phased out of use in the U.S. and Canada beginning in the 1960s. when polio was disappearing. And okay, the next one I'm putting up is showing there's a couple of advertisements on there. One of them says, "Only a little fly, you say? Yes, but what a dangerous monster. He can carry polio and many other horrible disease germs right into your home." They were using that on ads for DDT. At summer at the beach, sugared foods were consumed in large volume. Sugar is known to create a toxic environment in the gut, altering the balance beneficial and toxin-producing bacteria. With DDT, sugar created the perfect storm to damage the poliovirus infection. To damage the bowel and systemic immune system. Diets high in refined flour and sugar have a known impact on susceptibility to severe poliovirus infection. Harsh chemicals used in cane sugar production are thought to contribute to the synergy between an otherwise innocent virus and the sugar. In the fear-baked summers of polio, many parents were totally unaware that exposure to DDT alone induced symptoms that were completely indistinguishable from poliomyelitis, even in the absence of a virus. Acute gastroenteritis occurs with nausea, vomiting, abdominal pain, and diarrhea, usually associated with extreme tenesmus or the feeling of having to pass stool with the inability to do so. Coryza, which is a head cold, and cough and persistent sore throat are common, often followed by persistent and recurrent feeling of constriction or a, quote, lump in the throat. Occasionally, the sensation of constriction extends substernally and to the back and may be associated with severe pain in either arm. Pain in the joints, generalized muscle weakness, apprehension, and exhausting fatigue are usual. The latter are often so severe in the acute stage as to be described by some patients as paralysis. And that end of quote. So here are our DDT ads. DDT is good for me, they're singing along. It was being put on everything. So here we go. How could the doctors in the 1940s and 1950s possibly have distinguished a case that presented like DDT poisoning from poliomyelitis? They couldn't. Most people thought DDT was completely non-toxic and even healthy. Toxicity cases would have been diagnosed as polio and treated as such, often with crippling outcomes. It isn't surprising that Dr. Fred Klenner was able to cure 60 out of 60 cases with 100% of polio or 100% of polio, including bulbar polio, with the detoxifying agent, vitamin C, given in high intravenous doses. Funny, huh? Doctors were on the lookout for polio, but not DDT poisoning. It's no wonder polio appeared to be such a vicious entity. From the late 1800s up till DDT was phased out in the U.S. But that didn't happen until a vaccine was fully embraced as the savior of humanity in 1954. The U.S. was considered free of wild polio in 1979. Today, countries like India, who has a well-publicized polio problem, and China, both of whom still manufacture DDT, still have polio problems. In the U.S., breast milk levels of DDT are among the lowest in the world after years of banning DDT, but many other countries are still polluted with the chemical. And you see these ads they had here back then. They would go to beaches and spray this stuff. I mean, it was really, you just look at it and you just shake your head and go, how in the world could they understand like something like this was what it was? And here's a quote. Despite the fact that DDT is a highly lethal poison for all species of animals, the myth has become prevalent among the general population that it is safe for man in virtually any quantity. Not only is it used in households with reckless abandon, so that sprays and aerosols are inhaled, the solutions are permitted to contaminate the skin. Bedding and other textiles are saturated. Food and utensils are contaminated. DDT is widely used in restaurants and food processing establishments and as an insecticide on crops. Cattle, sheep, and other food animals are extensively dusted with it, and large areas are indiscriminately sprayed from airplanes for mosquito control. DDT is difficult and usually completely impossible to remove from contaminated foods, and it is not affected by cooking. Its accumulation in the fat and appears in the milk of animals who feed on sprayed pasture or in contaminated fodder. So you see, they were essentially surrounded by DDT. And is it any wonder they thought they had polio epidemic? Because they couldn't look beyond their nose and see what it was. The paralysis the world's witnessed in the first part of the 20th century was largely from toxins in the environment, like DDT, lead, and arsenic. These toxins seriously disrupt mucosal immunity, allowing a previously benign virus to bypass the innate immune system and cause paralysis and other clinical symptoms. Where those chemicals are still used today, you will see reports of paralysis, which used to be called polio, but authorities now call it acute flaccid paralysis. So when you hear that acute flaccid paralysis called, you'll know that that's from. Polio by arsenic poisoning. Arsenicals or compounds containing arsenic are some of the oldest known causes of poliomyelitis. Old texts considered arsenic to be a potent, effective, and safe, and was stated that it generally agrees well with children. It was prescribed by doctors for asthma and other lung problems, and it was added to tobacco for smoking, used for cholera on the basis that a greater poison would destroy a lesser poison, and dentists use arsenic to kill nerve endings and decayed teeth. Arsenic was used in many products such as wallpaper, fabrics, and dyes in the 1700s and 1800s. After removal of arsenic-containing pigments used on after removal of arsenic-containing pigments, arsenic poisoning resulted from medicines approved by the AMA. You ever hear of them, folks? The AMA, in the form of supposedly therapeutic injections. Arsenic was used on fruits and vegetables in lead arsenate and calcium arsenate sprays, which resulted in human ingestion. Massive spray programs in spring and at harvest are some of the reasons why polio was commonly referred to as summer diarrhea. After cold storage was used, the programs extended into the winter. Okay, I'm going to read this next part about Sister Elizabeth Kenny, and then I believe I'm going to, I'll go ahead and go to the end of this slide, and then we'll stop. Sister Elizabeth Kenny was a nurse from the Australian outback whose observations led her to treat polio with hot packs and physical therapy. When some of the first infantile paralysis epidemics were quietly beginning in remote areas of Australia, she was called to help. The year was 1912, and she was 23 years old with rudimentary medical training under her belt. In the pages of her autobiography lies evidence that the poliomyelitis she treated was chemical in nature, although at the time she had no idea what might be causing it. Years later, she became quite famous throughout the world for reversing the deformed physical outcomes of polio, which were often caused by accepted orthopedic treatments at the time. In her autobiography, she commented on that fateful night in the Australian outback. A very agitated father of 7 children came to me with the appalling announcement that his 10-year-old son and his 4-year-old daughter had been taken with what he called the cow disease, and neither of them could stand or walk. They went lame yesterday, just like the cattle have been doing for the past 2 or 3 weeks, he explained, and today they can't move. Cows are not clinically susceptible to poliovirus-induced poliomyelitis, but they were treated with arsenical dips to rid them of ticks, as noted in another part of Kenny's autobiography. On the range itself, the cattle had to be moved from time to time for grazing purposes and periodically dipped or run through a narrow canal of water treated with chemical to kill the ticks which infect the herds with the disease known as redwater, the archenemy of the North Queensland cattlemen. Sister Kenny was naive to the significance of these events, but today we know that chemicals can and do produce symptoms of anterior horn spinal motor neuron disease that were at the time clinically and pathologically indistinguishable from viral polio and indistinguishable from what we think of as polio. Next, congenital syphilis and adult syphilis. Arsenic-derived medications used and endorsed by the AMA and manufactured by Merck. Have you ever heard of Merck before? Well, the AMA let its seal of acceptance exclusively to drugs approved by Chair Morris Fishbein. One of the heavily endorsed products was the arsenical triparsamide, manufactured by Merck under the license from the Rockefeller Institute for Medical Research. This drug was used with the hope of countering the symptoms of advanced syphilis, often giving more than 100 injections to a single patient. And he's got, as a here, another patient who had previously received 34 injections of arsenifene, 23 injections of bismuth, and 76 mercury rubs had a paretic type of serology relapse after 104 injections of triparsamide. Good heavens, is it any wonder? It was widely known that any type of intramuscular injection could precipitate poliomyelitis, especially one with toxic chemicals and irritants. Arsenic, even if swallowed, caused symptoms indistinguishable from poliomyelitis. Two other arsenic drugs, neofarsamine and neosalviran, were well known to cause polio-like syndrome, diagnosed as polio. Reports in Germany in 1914 and 1928 on provocation polio by arsenic injections must have been overlooked. The AMA, Merck, and Rockefeller, despite warnings from the inventor of triparsamide regarding the danger, continued to distribute the drug, and the polio epidemics continued to rise. Next, we have undiagnosed syphilis. Is it possible that some polio victims could have been undiagnosed syphilis? Tabes dorsalis is the slow deterioration of nerves and gray matter of the spinal column, excuse me, and is a crippling symptom of syphilis. Syphilis that also affects gray matter of the spinal column. Syphilis used to be more prevalent than polio. Infants infected with syphilis at birth may be asymptomatic and not manifest signs commonly associated with congenital syphilis. Although neurosyphilis usually the posterior horns of the spinal cord, it has been seen that the anterior horns can be affected, just like in poliomyelitis, when there is congenital syphilis. This shows how congenital syphilis and polio could have been easily confused. The morbidity of polio then and now. The CDC, excuse me. The CDC defines polio's statistical paralytic rate and estimates that it is less than 1 in 100 for some type of permanent paralytic syndrome. Prior to vaccination, Dr. Maurice Brody reported that only 1 in 170 children with no antibody to polio became ill during epidemics. By these two drastically different risk estimates, you can see that statistics are not set in stone, nor are they necessarily a reliable indicator of risk. The CDC reports a 59% higher paralysis rate than was actually measured during a pre-vaccine epidemic. Dr. Brody seemed clued into the susceptibility factor, but he didn't proffer it any further, undoubtedly because he was also single-minded in the pursuit of a vaccine. Unfortunately for the dead and paralyzed recipients, Brody's vaccine was not safe, even though it was, in reality, no more dangerous than Dr. Jonas Salk's vaccine was in its 1955 production. Dr. Brody allegedly committed suicide at the age of 36 in 1939. The question to ask today is how much poisoning by chemicals and infection with other viruses was counted as polio in the statistics. According to the CDC, less than 1% of infected people develop paralysis, and 5 to 10% of that 1% suffer respiratory death. Yet in several polio epidemics, far more than 1% were paralyzed and even died. So there we go. We're going to stop right here then, and we'll take up next week. Thank you for listening.